Hi guys, I'm Dr. Siraj, your faculty of pharmacology, and I'm here to discuss very briefly about what are the subject-wise weightage in our FMG examination. Remember, the weightage that has been given by NBE on their website and on many other places is something like this: that anatomy, physiology, biochemistry is going to be somewhere around 17 marks each, and then patho, pharma, microbiology that is going to be somewhere around 13 marks each. Forensic medicine 10 marks, that will be pre and paraclinical, and roughly they are going to talk about 100 marks out of these 7 subjects. And from the remaining subject, that is clinical subject, that they say the number of questions that is going to be asked is somewhere around 200 questions. Now this is something that has been given, and ideally it should be followed, but when we closely monitor the examination, multiple examinations our team has been monitoring, and we came up with the actual number of questions that were asked. So nowadays what I'm trying to explain here is the fact that they are not actually following these, rather there is an integrated. So maybe there is an anatomy question that is integrated with orthopedics, maybe there is some physiology question that is integrated with pharmacology, or maybe some physiology question integrated with gynecology, right? So likewise, if you are going to see, the number of question per subject actually varies, because one question can be taken by forensic medicine also, same question can be taken by let's say psychiatry also, same question, same topic can be taken by pharmacology also, let's say drug toxicity, overdose, right? So all those topics are discussed in all these subjects. So actually, may this examination is a 300 question. You will be given 2.5 hours each, and remember, two parts may this paper will be conducted. There are going to be two parts that is going to be 2.5, right? 2.5 hours each. 2.5 hours each. And you are going to get a break also in between, है ना? अच्छा खासा break, around 2.5 hours का break also you are going to get, and after that you will be entering for the next part. Always do remember that in FMG examination there is no negative marking. You just have to bring 50%, and I very easily say that if you are one of the students, those who have worked in your medical college at least 1 to 2 hours per day, I'm not asking more, I'm saying 1 to 2 hours, especially with your notes, with your books, with your classes, you have given the examination of your medical college, you have passed them, it's going to be much easier for you to clear this examination in the very first go, because there is no negative marking. You have to just get this done within the first go. And I always say that first go is always the best go, first attempt is always the best attempt, because as the attempt increases, remember, your sympathetic drive also increases, your anxiety also increases, and ultimately the performance decreases because of all this, right? So let me quickly take you through the analysis that our team has taken from July 2021 to July 2025. So this is the pattern that they have followed. Usually, if you're going to see anatomy somewhere around, let's say 19 marks, then we have 22 marks. So somewhere around, see, anatomy 25 here. Now this is purely on the basis of the recall. Sometimes that some subject will have, let's say 1 mark, but it's never going to happen that pathology will have 1 mark. I totally doubt on this one, possibly because this pathology question is taken, some of the question will be taken by, let's say, maybe surgery, some of the question will be taken by, let's say, medicine, or other subjects as well. So this is not 100% true, but what I'm saying is this is on the base of the recall, because only person who can say that which question was asked is actually the student, and students are also confused after the examination. So this is the nearby data that we have collected, and in subject like, let's say, pharmacology, they say that they are going to ask only 13 marks, but believe me, whenever I take pharmacology recall, it's never less than 25. It's always going to be 24, 25, sometimes 27 as well. Why? Because some of the pharma topics are also discussed in forensic, in medicine, in physiology. So whatever topic that I discuss in my class, I usually do the recall session of that as well. So on the basis of that, I say 25, 27 always is going to be asked. So this was again overall assessment that has been done, and the only purpose of showing this assessment is to tell you that you cannot say that this particular question is gynae question, because the same topic can be taught in anatomy as well, and same, let's say there is a gynecology topic where they are trying to teach you what are the drugs that can be used to slow down the progression of labor. So that topic is also discussed in pharmacology, right? Ritodrine, isoxaprine, they are the beta 2 agonists. Maybe even the gynecologist also will be discussing that topic. Likewise, you have to understand and you have to prepare a topic rather than preparing that, okay, anatomy, say if I am going to read anatomy, my 13 marks or my 17 marks is done. No, no, it's not going to be like this. Even sometime it happens that, you have not done, let's say, your orthopedics well, and you are able to do orthopedics question on the basis of the anatomy knowledge. Or likewise, sometimes you have not done, let's say, your physiology well, and you are able to solve some of the physiology question on the basis of your medicine lecture or pharmacology lecture. So it's actually an integrated approach. Currently what we have is going to be your integrated approach that matters more. Currently it's always going to be integrated. Conceptual question, no one liners now. Conceptual, clinical based questions are actually going to be asked. Clinical based MCQs, which are actually going to be integrated, conceptual, and you cannot say that that particular subject question is going to be from this subject. Like for example, let's say someone is saying that radiology, say there is 13 question. It's never possible that radiology, say they'll be asking 13 question, because in radiology 13 question has been done in recall, possibly because they have given a clinical history of medicine and they have given, let's say, a CT scan or an MRI. So radiology no subject will also be saying, okay, this is my subject, because those topics are discussed in radiology as well. That's what I'm saying. So one subject is done, one topic is done in multiple subjects. So you have to prepare the topic, especially for all the students. If you are in second year, third year, and you have started preparation, believe me, try to prepare the topic well in advance, so that when you come here you will have much lesser pressure to handle. So you have to understand that it's not going to be a one subject at a time. It's actually going to be an all integrated approach, conceptual and clinical based MCQs. Remember, even the one liners, there will be one liners sometimes. Even the one liners that they were asked earlier has been framed into a clinical portion, right? So they are always going to talk about a patient. That is the typical rule. They talk about the patient. Earlier they used to say that, okay, there is a, which nerve is injured in Saturday night palsy. So now they're not asking which nerve is injured in Saturday night palsy. Now they are saying the word, let's say a patient went on a honeymoon, and or the patient went for a party, and he slept on the chair, and in the morning there was having this problem. He's not able to extend the wrist. Which of the following nerve is affected? So again, Saturday night palsy is something that they're actually talking about. So for even a simplest of the topic, they are going to talk about a patient. So you have to think like a doctor whenever you are reading a topic, okay? And PYTs are always the game changers. Please do remember PYTs, not the PYQs, because question will never be repeated as it is, but from that question, whatever other options are there, that is always going to be repeated. So PYTs are always and always going to be a game changer. So I hope this video will help you in a way to understand that the pattern of the examination has totally changed, and the number of question is not being followed as it has been given in the website. It's always going to be much different. Every time it's changing, right? This subject, if I'm done with my only 5 marks, because sometimes I see that students have done forensic medicine well and they're able to correct 10 question easily. Sometimes a student has done, let's say, this minor subject, let's say radiology, he has done nicely and he's able to do at least 10 to 12 question very nicely. Why? Because radiology topics are also discussed in other subjects, and they cover other medicine and other clinical subjects as well. And likewise in pharmacology, I see that students are always correcting at least 25 27 marks, but the guidelines says 13 marks. So you have to prepare the subject and you have to prepare the topic, right? As a whole integrated approach, you have to proceed, especially if you're in second year, third year, right? For all other students, those who are, let's say, already preparing, or they have 5 to 6 month topic, just follow the class room protocol that we always say. Try to finish the subject, revise the subject, and do the PYQs, do the PYTs. That is very important, right? So I hope this helped all of you guys. I'll see you in my next video. Thank you very much.